Vaccines for kids aged 5 to 11 will officially begin tomorrow here at the Metro Toronto Convention Centre and straight across the city. Public health experts are calling it another milestone day in the fight against the pandemic, though getting a child to a clinic isn't a simple task for many families. With Pokeroo in attendance, awkward handshake and all, the mayor and members of the city's public health committee toured the Team Toronto Kids vaccine setup at the convention center this afternoon, while giving another push to the public to vaccinate their kids.
The reward we will get is being able to keep the schools open, being able to keep people at their places of work, being able to continue to go to restaurants and enjoy life and sports events and things like that, and do it safely without people getting sick and putting stress on the healthcare system.
Throughout the pandemic, the city and public health have had to learn on the fly about the barriers and equity issues relating to vaccinations.
It's great that we have these large vaccine centres down at the Metro Toronto Convention Centre and other large vaccine events, but I think we also need things to keep in mind that sometimes it's very hard for parents to get to certain places.
Oh, what a great. Pediatrician and infectious disease expert Dr. Anna Banerjee has volunteered administering the COVID-19 vaccine in the GTA and remote communities. She notes many parents will have to take time off work to get their child vaccinated, and for many that could mean losing a day's pay. Having a variety of locations and times available will be key.
School-based vaccination clinics, after school, when the parent is going to pick up the child anyway, or an adult that, a guardian is going to pick up the child anyway, that makes it easier.
To ensure the vaccine is available to all who want it, Toronto Public Health has pledged to hold clinics at schools, though many locations haven't been finalized.
TPH and its Team Toronto partners have planned 230 school-based clinics as a hub-and-spoke model to service 390 schools in those neighbourhoods for 55,000 kids.
Anyone who's received the vaccine knows there's a risk of mild side effects that can be similar to COVID-19 symptoms, including a fever and fatigue. We asked Toronto's medical officer of health what to do if that happens. Does a child have to get a PCR test to return to school? And do they have to stay home?
If you think that your child is actually just with symptoms related to vaccine, probably best to keep them at home. Anyone who's symptomatic, we're encouraging people to, refrain from interaction with other people so as to limit the potential spread of disease.
CityNews has learned the first 3 school-based vaccine clinics will open tomorrow, but the locations aren't being made public for now. Toronto Public Health tells me that over the first 2 weeks, they plan to hold mobile vaccine clinics in 34 neighborhoods, chosen based on need, and will expand from there.